One of the things we wanted to do was to bring together all the stories from different care communities that we support, and basically to give people a sense that they weren't alone. They could connect with each other, learn from each other, network, and maybe find out new things.
So what we've been trying to do today is to make population health management real, but also make it simple, using a 3x3 grid that I developed with my colleague Mark Davies, where we look at the needs of people according to 3 big life courses: children, young people, working age adults and older people.
The event's great, and it's a really good opportunity to learn about different systems and how they're using data to drive insight into population health management.
It was really interesting to get some different discussions. There were some really interesting presentations.
And I think the key bit for me, having seen lots of this before, was that there was one person that was then responsible for holding all the partners to account. And I think that's what's missing probably in lots of places, is we have a lot of ideas, but then everyone just kind of goes back to doing what they normally do.
The key message is that population health management is based on not just data, but also on a wide variety of, if you want to call it, soft intelligence. And the challenge for us on the ground is to try and bring those elements together in the kind of way that will actually make it worthwhile.
So my challenge to the audience today, and indeed to my colleagues, is everybody but everybody is talking about population health management at the moment. Let's stop talking about it and let's start doing it.
I've really enjoyed today. I think what's been good about it is we've heard really practical examples of how getting the best data on population health can really make a difference to people's lives. And I've loved the stories that we've heard from across the country of how this is beginning to happen in practice and move beyond the theory that we've heard before into actually making a real difference to citizens.
I was talking about population health management, which is a term that probably most people don't really understand. And my message was, this shouldn't just be an abstract exercise in playing around with numbers and data. In the end, what matters is how you engage with people